You ever look at like a job title on LinkedIn or maybe a business card and you sort of tilt your head
Hmm.
and you think, okay, sounds fancy, but uh, what does that actually mean day to day?
Yeah, definitely. That moment of like title confusion.
Exactly. It
Yeah.
happens all the time. Well, today we're diving into a situation where this isn't just a passing thought, it's a genuine professional challenge. We're looking specifically at Nepal and how physiotherapists are designated there.
Right. And this isn't just guesswork. We're working from a really interesting document. It's titled Adaktan Tan de Belatan di Star.
Which translates to
Uh basically identity crisis of physiotherapist designations in Nepal.
an identity crisis. Okay.
Yeah.
Yeah.
And the author, Binaya Kandel, he really lays out the case. He's actually the senior most physiotherapist for the Nepal government right now.
Oh, wow. Okay.
Yeah. Co-chief physiotherapist, that's a 10th level position at the Ministry of Health and Population.
Mm.
And he's also chief of the physio unit at Bear Hospital, part of the National Academy of Medical Sciences.
So someone deeply embedded in the system.
Absolutely. And his background reinforces that. He's a former general secretary and spokesperson for the Nepal Physiotherapy Association and a PTA from 2021 to 24, and was an executive member before that. So he really knows this topic inside out.
Got it. So he's bringing years of leadership experience to this analysis.
Exactly. So our goal here for this deep dive is to really unpack this identity crisis he's describing.
Okay.
We want to get into the nitty-gritty of the titles, what the challenges are with the current system, and what some potential fixes might look like.
Right. To give everyone listening a clearer picture of what's a potentially confusing but really important issue for healthcare there.
Precisely, for the physios themselves and, of course, for the patients they serve.
Okay, let's get into it then. The document first lays out the official government structure for these roles. So it's not like there are no titles.
That's correct. There's a formal system defined by the Nepal Health Service Act that was from 2053 in the Nepali calendar, and the Health Service Regulations from 2055.
These are the main laws governing the health service roles.
Yes, exactly. And within that, there's a hierarchy. You start at the assistant level, which is physiotherapy assistant. That's designated as FIC level.
Fifth level, okay.
Then you move up to the officer level, and here it gets a bit more layered. There's physiotherapy supervisor at 6th level, senior physiotherapy supervisor at 7th level, and then also at 7th level, just plain physiotherapist.
That's interesting. Two different titles at the same level. 7th, senior supervisor and physiotherapist.
Yeah, it does make you wonder a bit about the distinction in practice, doesn't it?
It does. What comes next?
Okay, then you have senior physiotherapist at the 8th level. After that, deputy chief physiotherapist, 9th level.
Oh.
Then co-chief physiotherapist at the 10th level. That's Binaya Kandel's current position, as we mentioned.
Right.
And the top is chief physiotherapist, 11th level.
So a clear ladder exists, at least within the government health service structure. These levels, they generally track with more responsibility, experience, pay, that sort of thing.
Yeah, typically within the civil service framework, that's how it works. Higher level means, more seniority, different scope of work.
And here's the crux of the identity crisis, it seems. Despite this structure, there's a gap when it comes to specialist titles, like what you see for doctors.
Exactly that. That's the core issue highlighted. Physiotherapy is recognized as its own autonomous medical field, modern medicine. And people do postgraduate studies, they specialize.
Right.
But the problem is, unlike, say, medical doctors or nurses, pharmacists, even Ayurvedic doctors, the Health Service Act and regulations don't have specific specialist or consultant designations baked in for physiotherapists, particularly at those higher levels, like 9th and above.
Ah, okay. So you could do years of extra training, specialize in neurophysio or musculoskeletal.
Precisely.
But your official government title might not reflect that specific advanced expertise.
That's the problem. The official structure just doesn't have those subgroups or specialized title pathways defined for physiotherapy. The document even notes that some of the existing higher-level titles seem sort of borrowed from, like medical lab tech or radiography fields, which operate on different principles than physiotherapy.
So the advanced training exists, but the formal recognition within the government job structure lags behind. I can see how that would feel like an identity issue.
Definitely. It can impact morale, career progression, and crucially, it makes it harder for patients or even other referrers to identify physios with specific advanced skills.
Okay, now what about the Nepal Health Professional Council, the NHPC? You mentioned them. How do they fit into this picture regarding titles or recognition?
Right, the NHPC. They're the regulatory body. They register all sorts of health professionals, including physios, and they do have different registration levels based on education.
Okay, what are those levels?
So there's the special level that's for people with a postgraduate degree or equivalent.
Master's level, basically.
Generally, yes.
Yeah.
Then first level is for bachelor's degree holders. Second level is for certificate level, like a diploma perhaps. And third level is for those with at least 1 year of training.
So the council does differentiate based on the level of education achieved.
It does, through registration. And here's another interesting layer. The document mentions that the NHPC actually has processes to register and even hold separate licensing exams for over 10 different physiotherapy specializations within that special level registration category.
Oh, okay. So they do recognize specialties like musculoskeletal, neuro, cardiopulmonary, etc. at the registration stage.
They do, for licensing within that special level. But, and this is a key point from the document, there isn't a distinct registration category or, say, a higher level specifically for people who've gone even further, like PhDs or those with a clinical doctorate in physiotherapy, a DPT,
Ah.
or fellowships, or even specific postgraduate diplomas.
So even if you get a doctorate, you're still registered under that same broad special level umbrella as someone with a master's. There's no specific NHPC category acknowledging that higher qualification.
Apparently not, according to this analysis. So you have the education, you might even have a license in a specialty, but the registration system itself doesn't fully signal that highest level of academic or clinical achievement in a separate tier.
Yeah, that feels like another disconnect. It sort of undercuts the value or recognition of that extra work and qualification, like you said, an identity thing.
Exactly. It all feeds into the sense of ambiguity.
Okay, so that's the government structure and the regulatory body. What about outside of that? The private sector hospitals, clinics, NGOs?
Right. The document suggests that's where things get even more varied and potentially more confusing.
Because they aren't bound by the strict government levels.
Pretty much. In private hospitals, clinics, rehab centers, NGOs, you see a much wider range of titles being used based on surveys and what the author has observed.
What kind of titles are we talking about?
Well, you see some overlap with the government ones, like assistant physiotherapist, physiotherapist, senior physiotherapist.
Okay.
But then you also find titles like consultant physiotherapist, physiotherapy officer, sometimes even things like manual therapist used as a primary job title.
Consultant physiotherapist. That sounds like it implies specialization, but is there a standard for using that title?
And that's the problem highlighted. The document points to a weak legal basis for many of these private sector titles. There's a real lack of uniformity, meaning one clinic might call someone a senior physiotherapist after just a few years post-bachelor's, while another reserves that for someone with a master's and, 10 years experience. Or consultant might be used based on internal criteria, not necessarily a specific qualification recognized across the board.
So no consistency linked clearly to education or responsibility.
Largely, no. And then you add in people putting various degrees after their names, which is fine, but without standardized titles, it just adds to the potential confusion for patients, for insurance companies, for anyone trying to figure out who does what and with what level of expertise.
Yeah, I can see that. If you're a patient looking for help, seeing physiotherapists, senior physiotherapists, consultant physiotherapists, all listed, maybe even with similar sounding degrees after their names. How do you choose? How do you know who has the specialized skills you might need?
Exactly. It makes informed choice difficult. And as the document argues, it contributes significantly to this overall identity crisis for the profession in Nepal.
Okay, so the problem is clear. A mismatch between education specialization and recognized titles in government, and a lack of standardization in the private sector. But the document doesn't just leave it there, right? It proposes solutions.
Correct. It outlines several potential ways forward.
What's the first big one?
The first major recommendation is about legal changes, specifically amending the Health Service Act and related laws
To do what?
to formally allow for and create those specialist designations for registered physiotherapists at the higher levels. ninth and above, similar to how it works for doctors and other groups.
So building that recognition right into the law for government positions.
Precisely. This would mean tweaking the health service regulations too, specifically Schedules 3 and 4, which deal with titles and creating subgroups within professions.
Okay, subgroups. So you could have an official title
Like consultant musculoskeletal physiotherapist
Hmm.
or consultant neurological physiotherapist, for example.
Sure.
The idea is to base these official subgroups on the specializations that the NHPC already recognizes for licensing.
Ah, connecting the dots there. Using the existing recognized specialties as the foundation for new formal government titles. That seems logical.
It provides a clear pathway for recognizing advanced practice within the government system.
Okay, that addresses the government side. What about the private sector confusion?
The second main proposal tackles that directly. It suggests developing uniform standards for titles used in the private sector.
Standards developed by whom?
The idea is a collaborative effort. The Ministry of Health, the NHPC, and other stakeholders, maybe including NPA, the Physiotherapy Association,
And these standards would define titles based on...
based clearly on educational qualifications and, importantly, on job descriptions or scope of practice. The goal is consistency. So senior physio or consultant physio would ideally mean something comparable across different private settings.
And maybe guidelines on using degrees after names, too.
Yes, the document mentions that as well, bringing some clarity and standardization to how academic credentials are presented alongside the job title.
Right, so that the whole picture title plus qualifications makes more sense to everyone. Okay, that's two big ideas. Legal changes for government, standards for private. Is there a third?
Yes, the third major recommendation is about governance for the profession itself. It proposes establishing a separate, dedicated physiotherapy council.
A whole new council, or part of the existing NHPC.
The document suggests it could function under the NHPC umbrella or potentially be independent. The key is having a body specifically focused on physiotherapy.
And what would this dedicated council do?
Its role would be multifaceted. To enhance professional recognition, obviously, but also to enforce ethical conduct, manage these professional designations we've been talking about, streamline registration and certification, and improve license renewal processes. Basically, a dedicated body to oversee and advance the profession.
Giving physiotherapy a stronger, unified voice and regulatory structure. That could definitely help address the title issue and other professional matters over the long term.
That seems to be the rationale. Kandel concludes the analysis by stressing that if this identity crisis isn't resolved, it's going to hurt the profession's development.
Very patient care, ultimately.
And patient care, absolutely.
Yeah.
Achieving that uniformity, both in government and private sectors, through these kinds of legal and structural changes, is seen as crucial.
So it needs real collaboration. Government, regulatory bodies, the physio community itself.
Yes, the call to action is clear.
Exactly.
These different groups need to work together to take concrete steps. It can't just be talked about. Changes need to happen.
Okay, so boiling it all down. The core issue, this identity crisis, it's really this gap, isn't it, between the reality of advanced physiotherapy education and specialization in Nepal,
Right.
and the lack of clear, legally recognized specialist titles, especially in the government system. And then this spills over into the private sector, causing, well, a confusing free-for-all with titles.
That sums it up well. The recognition framework just hasn't kept pace with the profession's evolution.
And this lack of clarity, it's not just an internal professional issue. It affects how physios see their own careers, sure, but also how
Like
patients...
other healthcare professionals.
Yeah, how everyone understands and values what specialized physiotherapists can actually do.
Exactly. Trust and understanding are built on clarity.
It really underlines how important clear professional titles are, especially in healthcare. You need to know who you're dealing with, what their expertise is. It makes you wonder, how many other specialized fields might face similar growing pains with recognition, maybe in other countries too?
It's a pertinent question. And this situation in Nepal really throws a spotlight on it. Thinking longer term, with healthcare getting more and more specialized everywhere, what happens to a profession if its most advanced practitioners aren't clearly and consistently recognized by their titles?
What is the ripple effect when that clarity just isn't there? Something definitely worth pondering.